Good morning and welcome to Health 101, Getting Started in the Health module. My name is Karen Brulard, and we're going to be taking a look at an overview of the Health module. Excuse me. We'll be taking a look at an overview of the Health module today in MMS. And we're going to look at MMS generations, and what you'll notice is that there is a toolbar across the top of the page, and that allows you easy access to the different pieces of the health module. We have the log health office visits, the medications management, immunizations, student health history, and screenings. Also, we have a health management jobs on the left-hand side on the toolbar, so some of those options can also be accessed through that health management jobs. You can go into the log health office visits from there if you prefer, as opposed to the toolbar. Also medications management and some of the other options. And then you also have the opportunity to edit many of the different choices and options and codes that we will see in the health module, and then run various reports as well. And we have some different operations available also, such as the health mail merge. For example, if you were mailing or emailing information to parents regarding health items related to your students. So what we're going to do is initially here, we're going to have an introduction to the 5 main components that we talked about here in the toolbar. So the first one we're going to take a look at, and I'll just go ahead and use the toolbar here since that gives me easy access to the health module and some of those options. The purpose of logging health office visits is to keep a daily record of student visits to the nurse's office, and much like other places in MMS, we have different tabs available. The first one that we see is the log of health office visits. So it defaults to the current date here, and we can see that there's a health office visit here for Amy, our student Amy, on today's date, and she came in at 7:45. And we have drop-down choices available, and these are options that can be edited as you need at the school. And there's different places that we edit the various codes that we're going to see in the health module. But the choices that we make, for example, if I come over to this edit codes option here, these particular codes, a helpful reminder, if we go to the help, we get a description of what we can do in the Edit Codes tab. You'll find that the MMS help is very useful to identify the step-by-step process on each operation, and the purpose explains what we are doing on that particular code, on that particular tab. So in this instance, we get a reminder here that we are able to make adjustments here to the choices of reason for visit to the nurse's office, assessment of the condition, intervention, what the nurse did to assist that student, and the discharge. So many different helpful options in the helpful choices. And we can choose any of the items here on the left-hand side if we would like for those health office jobs. We see our health jobs here, and then each of the tabs are described for each of the different functions. So let's go ahead and exit out of here for now. But that's something very helpful to remember, that that's available at all times, that red question mark, that MMS help. So if we look, for example, at the categories here, if there is a particular code that we need to add, then what we would do is the add a new record, and we can choose which category, the 4 different ones that we mentioned, the reason for visit, assessment, intervention, or discharge, and then the new health office visit code here. So if, for example, I want to include another reason for a visit that I don't see in my choices for the log of health office visits, what you see over here in the categories and codes is that the categories are ordered according to assessment, discharge, intervention, and reason for visit. They're ordered alphabetically, and then the codes are used to represent these particular reasons that the student would be visiting the office, either the reason for visit, assessment, intervention, or discharge, and whether that item is particularly an injury. So here for the new health office visit code, if I want to add a reason for the visit, I'll add ALL here for allergies. Because I don't think I have that in my drop down at the moment. And then I can also save that, and it will add it to the list. So we can see what the different choices are by looking at these codes. And if I go down to my reason for visit codes, you can see that it added my seasonal allergies here. And if I go back over to the log of health office visits, and I choose from the drop-down, you can see that's now an available option. So whereas I had selected cough, if a more accurate reason would be seasonal allergies, then I can choose the option I created in the edit codes here. You also have the option, as you can see, to put in a time out of the nurse's office, and then you can indicate whether that particular visit should be left as open, or you have the option to close it if that student is in fact leaving the office. You can also choose to hide the reason for visit as needed for confidentiality reasons. If somebody else walks in perhaps to your office and you have MMS up and running and you don't necessarily want others to be able to see that confidential information, you can hide that particular column, and that's really a toggle on and off. So if I click on it again, it brings back that reason for visit. And then if you have multiple reasons for visit, you can choose to order by code or description. And then you see you also have an option here. If you have multiple visits through the course of a day, you can choose to close all of them at the end of the day, for example, if you wish. You can also choose to show only those visits that are related to injuries, and this instance is not an injury, so it's not going to show that. It's not going to make any change here. And then you can also indicate a date range if you wish. So if, for example, I wanted to take a look at the health office visits for the school year, and I'm just going to go back all the way to August 1st of the prior school year, you can see that this list refreshes here and shows the students, the dates that they have come in to the nurse's office, the times, the reasons, and so forth. So you have that option as well. If, for example, I have a student here, let's say Christine Abiatici, if, for example, I insert a record that is in error, then when I choose the option to delete a record, I will get a confirmation, and what will happen is it will mark this particular record as in error. So you have that option as well, and I'll say yes to that, and then we see that indicator for that column in error. If I have a new student, I think I mentioned this, walk in on any given day, I click on that add a student, I choose the student who applies, I'll just choose Charles in this instance. It brings Charles's name in here, it inserts today's date as the default, and the time, the current time, and then again I can choose the reason for visit according to the codes that I have set up. And then again I have the additional information over here to the right hand side as well that I can put in. I can also add notes. And when I save this particular record, it will save that note along with that student if I need to come back and amend that at any later time. Then I would go to that amended notes section. And I don't have notes for some of these other students. I may have for some, but not for all. So that's the log of health office visits. In the details of the visit, and I'm going back to Amy here, the student who came in this morning, you'll see that there are two different tabs available here. The reason for visit, so it will pre-fill some of this information from the log of health office visits and the date and time. You can indicate whether that visit was planned or not. So if you have, for example, a student that is coming to the nurse's office to receive medication that perhaps a parent or a contact had brought in to the nurse, then you would be indicating that as a planned visit. So you have that option. You can also indicate the teacher that is responsible, where that student is currently located in the course of the day, and also you see the status. And when I click on time period here, we see the different options that are available. In this instance, we had said before school when we logged the health office visit. And then if there's an additional location, which is coming from your rooms table in school management jobs, then you can indicate that as well. So if there was an accident that occurred, perhaps on the playground, in the cafeteria, whatever the case may be, you can indicate that as well. And then if there were any notes, it will indicate the notes. And then in the assessment intervention discharge, again, these options that we see are coming from the codes here in the edit codes. And so that's what drives these drop-down options here for assessment, intervention, and discharge. And then if we need to add any of these items, the assessment, intervention, or discharge, we simply choose the add option and it will insert a new line here for the assessment diagnosis in this instance. And again, if we need to come back and delete, such as the second entry here for the assessment, then it will in fact mark it as in error so that it is retained in MMS for record keeping purposes, however, indicated that it's in error. And then you see you have additional notes available here. So for the intervention planning, in this instance, I added a note here, refer to family doc, contacted parent via phone, and then the discharge is that the student was dismissed, and the mom was picking up and taking the student to the doctor. So you can indicate additional notes that way. And then if you want to see additional history for this particular student, we're looking at Amy, then we can go to this particular tab and it will show us the different visits that are documented for Amy, any notes and so forth that we put in. And if we want to see the schedule for this particular student, such as if we need to get in touch with the teacher and have the student come to the nurse's office, then you can see that student's schedule right here within the log of health office visits, and we talked about the edit codes. So those are all the primary components there in logging the health office visits. So I'm going to save and exit out of that. And the next item that we'll take a look at is the medications management. So here, what we have the opportunity to do is to document and keep track of any medications that are being given to students. So it's bringing me in here. Again, we have our tabbed format, the medication orders, the medical log, medication tracking, viewing classes. Again, that option is available, and also the edit medications. So I'm going to move over for a moment here to the edit medications because, again, we have the option here if we need to add, amend, edit in any way the list of medications that are available for students. This is where we edit those particular codes and options. So you can see all of the ones, if we scroll down through the list, that are currently indicated here, all the different medications, that type of medication, the code, the strength, the form, and these also have drop downs as well, whether it is a prescription drug, an over-the-counter drug, or a controlled substance. So as I scroll down here through the list, looks like most of the ones in here are prescription drugs. But there may be instances where you would need to add another option here to the medications list, or make an adjustment to the strength, the form, or the name. So that is where you would accomplish that here in the edit medications, and that will drive the options that you see then in the rest of the medications management portion. Go back to the medical log here. And so again, it's going to default to today's date. And I'm going to add a student here, and I'll just pick Amy in this instance. So it will also insert the date and time. Again, our reason for visit here. So it could be daily medication, it could be there was an injury, it could be just for the purpose of dispensing medicine if that student comes to the nurse's office on a daily basis or a regular basis, and so forth. So I'll just choose the option here for daily medication. We'll use that as an example. And then for our status, we can either indicate that the student was absent that day, the medication was administered, or the student was a no-show. So you have the ability to capture and track all of that information. So I'll put administered in this instance. And then for order, you have the ability to indicate whether that is something that the nurse decided that he or she needed to administer, or whether that was something that came from the student's medical doctor, for example, the student provider order, and we'll talk about that. Also, we'll go back to this medication orders tab and see the information that we can enter there. And you have the option then to indicate PRN if that fits, that student was administered a medication for those reasons, and then your medication names. And we saw where that comes from in the edit medications. Also, so let me choose a medication here. I'll just choose an allergy medication for this instance. Also notice if you scroll to the right, you can see additional information. It inserts all the information about the medication, the type, the code, the strength that comes from our edit medications. And then again, we can indicate the scheduled time that the student is coming in to receive that medication, the time out, and it will automatically indicate who is logged in here to the health module and administering that medication. Now, also note, I talked about the option here for the medication order. So a couple of different ways that we can enter that information and keep track of that in MMS. We have this tab for medication orders over here. So we have the ability to add a record prior to going to the medical log and determining how and why that student is having medication dispensed. So if I do an add here, I can add all the required information. What I also wanted to show you though is if you're in the medical log, you also have a button here, and if I click on this medication order, I get an alert message reminding me that there are no standing medication orders for this student. So that may be helpful to know that we need to then go set that up if, for example, this is an order that came from the doctor. So I'm going to go back to medication orders and I'm going to add a new record, and I'll just put in today's date here and the medication type. And I'll put in the same that agrees with what we put in for the medical log here. So I have the order date and type of the medication. Excuse me. If there are multiple medications listed here, you can order them by code type or name. Then again, in our tabbed format here, we have the order information, so you can document any specific details related to the medication order that the student may be bringing in that came from, or the parent may be bringing in for their student that came from the doctor. You can see the options available here: diagnosis, contraindications, side effects, specific directions, other medications, and so forth, and allergies. You can document all of that information, and then also dosing information, health provider information, and if I choose get data from health providers table, and maybe I don't have any information in there right now, so that there's an option here in the health management jobs. If I go to more health editing jobs, there's an option here, edit insurance and health providers information. So if I click on that, and in this instance, I have some insurance information available here for Amy. So if I add that information here, then I should be able to pull it into the medications management. Let's see if it wants to come through here. For some reason, it doesn't want to pull over. If we move over here to the next tab, we see that we have an option for the parental or guardian consent for this student. It documents what that medication is, the dosage information that we put in, and allow school nurse or designated personnel to give the following medication. and then we can indicate parental permission to self-administer, yes or no. So we'll just say no to that. Permission to share information with appropriate school personnel, so you can indicate that as needed. And permission given to carry emergency medication, so that may or may not apply. I'll say no in this particular instance. To send medication on field trip with student, so that may or may not be necessary. I'll just say no in this instance. Parent guardian sign form, I'll say yes to that. And we'll just say other in this instance. And then what I can do, if I go up to this print button, it shows me the medication orders report. And if I go down, and I'm just going to select the one that we were working with, the Zyrtec here, you have different options that you can take a look at here. So you can print the contact name and address. So maybe we want to see that in this instance. We can designate which contact, and we designate what we want to print, the complete medication orders report here. And since we're looking specifically at Amy in this instance, we don't have the option for student range to choose a group of students, because we're looking at an individual student record here in the health module. If we wanted to print this for a group of students, then what we would need to do is access it under the reports in the health management jobs. So under more health reports, if we printed the medication orders report, if we selected it, we would have the choice to indicate all students who we wanted to print this for. And so I'm going to go ahead with the output option. I have that set up to a preview in this instance. So I'm going to go ahead and leave it set up that way so you can see what that looks like. And so it will print out, or it will display for you. You have the option to print or save a soft copy of the medication order for this particular student, for Amy, and the contact information according to the contact we selected, that contact information specific to phone number, and then any other information that we put in to MMS would be indicated on that form here. And we have a line here for the signature of the health provider. So if you need that signed by a doctor, you can send that, with the parent or student to have that signed, and then also the parental consent. And these options are indicated then according to the choices that we made. So if we wanted to actually print that out, we could choose the option to print report. And I'll go ahead and just exit out of that at this time. And then if there are any additional notes, if we need to copy and paste from a parent email about this medication order, for example, we could do that. This is, have the opportunity for a fair amount of text here to document additional notes on the student. So that takes us through the medical log and medication orders. If I go to the medication tracking, and I don't see anything indicated at the moment here, so what I will do is I will go ahead and add a record, and I'll just choose Amy again in this instance. So it shows me the medication for which student, when I received this in the nurse's office, what time, who brought the medications in, the relationship of that individual to the student, the name of the medication, and then I can scroll to the right as well to see additional information about that medication. The count received, so maybe I received in the nurse's office 5 of them, just for example, how many of those allergy tablets in this instance, and who that was given to, which will default to whomever is logged in to the health module here in MMS. And again, I can choose to order the medications. If there are multiple medications listed here, I can order them by code type or name. I can also hide the names of the medication for confidentiality reasons. And then also notice I have the option to print a sign-off form here. I also have the opportunity to designate a date range as needed. So if I click on this print sign-off form, we can see what information will print out on that, since we're looking at a preview here. And it just documents exactly what was received and by whom, and there's an opportunity to have that signature line then for the parent or guardian. And again, if you want to see that in a different format, like a soft copy, a PDF, or whatever the case may be, if that's something you need to keep on file in soft copy or have available for email reasons, then you can certainly choose the format you want and name the file and the location where that needs to be saved. Again, as we said, we have the option to view classes for this particular student that we're looking at, and then that way, if the nurse needs to get in touch with a particular teacher to have Amy come down and get her medication, then the nurse can see where Amy is currently in the course of her day as far as her schedule goes. And we looked at the edit medications. So that takes us through the medications management. So I will go ahead and save and exit there. The next option that we're going to look at here is immunizations. So we have the ability to document all immunizations for a student. You can see some sample information here for Amy. So just so that you know, we're going to move again over to the compliance requirements here, so that if you need to download the system defaults, for example, there is an option here for state immunization requirements. And when you go to that, you have the ability to have up to 10 different settings available. So depending on your state, that will be what is indicated as part of the description here. So I have some different years on file in my particular example here. These defaults get updated within MMS generations so that you can simply pull them in. As you see, you can select the state that applies and then load the default settings as well. If you need to add a particular set of immunizations, you see here you have the disease groups currently defined, which is based on the defaults that load that are available in generations, and based on the disease group that we see here for tetanus, diphtheria, for example, the different dosages are listed here on the right-hand side. So if you see that you need to make an adjustment, for example, based on your specific state requirements, you do have the ability to add a group if needed, to modify the doses as well, and you also have an option that you can print and look at the particular immunization requirements. So if you want to compare that, for example, to what is on your state's website at the Department of Health for schools, and so forth that relate to the immunization requirements, you have that option as well. And mine is set again to default to a preview. So let me go ahead and click on print, and you see an example here that you could then in fact compare if needed. So that's where those particular immunization requirements come from. And then also, just as a note here, we can see the student's health history here in the immunizations. And if I move back then over to immunizations, I can see that entire list of immunizations for Amy. If I page ahead to the next record, I will see that information for another student if that has in fact been entered. So when you receive that immunization information from the student's provider or doctor, then you can enter that information here in MMS Generations. You also have an option for provisional admittance. For provisional admittance. You can indicate yes, no, or clear. If there is a particular exclusion date, you can enter that as well. If there are, in fact, exemptions, you have a column that you can use to indicate those exemptions. And then we also have additional information here that you can document and capture and record about the immunizations, whether you in fact received that documentation from the student, parent, guardian, medical doctor, whether it was a written, a verbal, or both, excuse me, and then additional information here related to the particular immunization you're looking at in this instance, when that was administered. And if in fact the school administers that information, you can document all of the dosage and vaccination information right here on the right-hand side. If there's an expiration and so forth, all of that can be captured right here in the student immunizations. And then we talked about exemptions when we were looking at the immunizations tab. So if in fact the student has an exemption for a particular vaccination, then you can indicate whether it's a medical exemption, the date, the source, and if that applies to all records for that student. Also, you can indicate a religious exemption or a philosophical exemption. So those items will certainly relate to your state requirements and or school procedures on immunizations. And then you also notice, by the way, when we come back, I came back to this compliance requirements here just to note that if we look at the different disease groupings, we can see we get a message down here at the bottom. Student is compliant per requirements in the particular, in this instance is the 2013-14 for Pennsylvania. So we can see a message on that. We can get a confirmation on that with these immunizations. So those are the basics and overview of immunizations. If we go to the next option here, the student health history, again, we see for Amy that there are two particular health conditions listed. And just a note on those health conditions, if I go over here to the health management jobs, down to the more health editing jobs, we have an option here for the edit health condition codes. So you do have the ability to add, adjust, edit, modify as needed for the particular health condition codes. And so, for example, let me go down. Let me find okay, so the allergy bee sting is an example that we happen to be looking at for Amy. And so what I want to point out particularly is a couple things here. On the right-hand side, there's a confidential flag that you can indicate for any particular condition. Also, if you want the sort, or if you want to adjust the sort order in the drop-down box, you can indicate that as well here by using the up and down arrows for these particular choices. Otherwise, they'll be listed alphabetically. The post to health alerts is important. That will drive what we see here, this alert that's coming up, the question mark. So because Amy has this allergy bee sting assigned to her as a health condition, and we have that indicated as post to health alerts, that's why we're seeing this particular alert here. And then also, for example, if you have students with peanut allergies or other allergies that you want to share as part of a school lunch alert, you can also indicate that here. It doesn't apply in this instance, but you do have that option for school lunch alerts. So this is where those health conditions are coming from. Also, in the health menu here, you have the ability, if, for example, you're setting up your health module for the first time, then you have the ability here for the health condition codes. You can come to that particular menu option, and for health conditions, communicable diseases, and immunizations, you can go ahead and process, and it will load all of the system defaults so that you don't have to sit there and just enter all of those. For example, what we saw with all the health condition codes, there is a list of defaults available right in the health module. So you would just choose the ones that you want to in fact load and transfer into MMS generations. So those health conditions are going to come from the defaults and the edit health conditions option that we looked at. So again, then for each health condition, you can indicate the date that that was documented, and it will then calculate the age of the student, whether in fact it's confidential or not, and you can also add notes. So there's just a sample note there for the student. And you can change the sort order as well. So again, in this instance, we're looking at Amy. We can choose to locate a record and look at another student. So you always have that locate a record to choose a particular student if you wish, or you can use the navigation to page forward, backward, to the beginning or the end of your student list as well. If you have a new student, for example, and you need to add a particular health condition for the student, then the same way that we looked at adding a record for medications management, for health office visits, and so forth, you would simply add a record here, and then you would be able to indicate that particular health condition. And we have ours grouped with the HCN code, the health condition code, as a quick and easy identifier and a way to keep these sorted based on the edit health conditions job that we looked at. So maybe we have another student with a bee sting, for example. So we can document, the date, the student's age, and so forth here. So we have the ability to edit that health history as needed. So I'll go ahead and save and exit there. Actually, let me go back to that for a moment. The health history let me go back to Amy. So again, now what you'll notice is if I choose this print option here in the Edit Student Health History, then what comes up is the student's health history report. And again, in this instance, we are looking at this for the particular student that we selected, which happens to be Amy. So we don't have the option for student range in this instance. So a number of different options we have on this health history report. As you can see, we can order the health conditions by code or description, and that becomes even more meaningful probably when we're selecting a large group of students, maybe a grade level or the entire school, and wanting to sort or group in a particular manner. We can choose both confidential and non-confidential codes depending on how we've indicated those health condition codes, or we can choose one or the other. Then we can also pick and choose the different options. We can choose more than one option by holding the control button down. In this instance, we'll just look at, or we can choose all of them if we wish, or let's see, so if I choose confidential codes or non-confidential codes, then it knows how to sort those. So I don't think I have any indicated as confidential. That's probably why nothing's coming up there. And then also select report options, the complete health condition report, or I can limit according to a particular date range. If I do that, I can insert the date range here. And we'll look at what a sample report looks like for a larger group of students rather than just one particular student in this instance. And then in this instance, here starting a new page for each student doesn't really apply because we're looking at Amy's information, but if we were looking at the health history report over here in the health management jobs, and I'll come back and do that so you can see an example, then we would have the option to indicate starting a new page for each student becomes more meaningful, of course, if you have a group of students. So we'll come back and look at that. And then you can also print contact information, designate which contact, and so forth. So mainly what I wanted to illustrate here, though, for looking at a particular student, oh, it wants a date, that's why, because I chose to limit the date range. I'll just go back to the complete health condition report. So at least you can see a sample. Not a whole lot of information entered here for Amy. However, depending on which health piece that we're looking at, that will determine what report will come up for that particular student in that particular piece of the health module. So that's what I wanted to illustrate there. So let me exit out of, I'll save and exit out of the student health history. And then we also have a section here for screenings. Again, I can choose the particular student that I want to look at. And then as you see here, I have the first tab I come to is the screenings tab, and I can indicate the date, the description, who examined the student. It will automatically default then to the person who is logged in to MMS. If there's a phone number, it will also include that information. And if there are very specific screenings that you want to capture, you see that you have an option for physical screenings. So you can indicate the date, the pass or fail. You can indicate any vital signs on that particular student, temperature, blood pressure, height and weight, and so forth, when the next physical is due, if that physical was signed, and so forth. So there's a lot of information that can in fact be captured related to the physical screening. You can indicate whether that student is fit for physical activity, whether they need a recheck, whether they were referred, such as back to their medical doctor, and so forth, any physical restrictions as well. And then we also have screenings for vision, as you can see here, with the different vision criteria that you can enter. the details about that vision screening, the hearing screening, the dental, the spinal, and any additional testing as well. And we also offer live webinars on screenings as well as the other health modules in much more detail. So if you want to learn more about one of these particular modules, whether it's medications, health office visits, health history, or screenings, then we certainly welcome you to any of our other live webinars on these particular topics. If you want to talk about additional details of what is located here, also remember that you have the MMS help that's always available for many more details on the particular module, the operation that you're looking at, the function that you're looking at in MMS. Also, something important something else to be aware of on our website. If you use your school's account number to access the resources on our website, then what you'll find is we have the webinars and sign up. If you want to see the list of classes currently available and you have a subscription or you just want to sign up for a particular class, we have a video learning center that has some nice short, what we call tech bites, between 5 and 15 minutes in length on different topics if you need a quick refresher. We also have our pre-recorded webinars for full-length webinars related to health topics and many other topics. You can see there's health history, medications, health office visits, and then additional also state reporting and portals. So a lot of fantastic resources right at your fingertips there. And then also, if we go to the knowledge base, you can actually do a search for any particular topic, and any matches for that particular topic will be listed for you. It's a searchable knowledge base. So for example, there's some different items here. Activating health alerts, like which we talked about, assigning them to students, getting alerts on a homeroom list, activating health alerts for lunchtime. So these are all really, really helpful tools that are right at your fingertips. So you have the MMS help available, you have the knowledge base, you have the video learning center, you have the live webinars. So many, many different resources available. So I'll go back over at this time to MMS Generations. And again, this particular session today is intended as an introduction to the different aspects of the health module. So we don't go into every detail about all of the different components of each. But hopefully that gives you a nice introduction to what's available, what can be captured, and so forth. So let's take a moment then to come down to the health management jobs. So again, a couple of the menu options that we see are just another way that you can navigate to the same options that are available on the toolbar. If I wanted to, we looked at the health student record listing for a single student. If I wanted to look for that, if I wanted to look at the health student record listing for a group of students, we'll look at a different one. For some reason that doesn't want to cooperate right now. Let's choose a different report here. And if I wanted to see the log of health office visits, for example, on a group of students, let's say for the school year, whatever the case may be, then I can go to any of the available reports in the Health Management Jobs menu. And what you'll notice, first of all, is that you now have this option for student range, which we didn't have when we were looking at an individual student. So if I choose student range, I can leave it selected as all students. I can choose to deselect my students, and I can sort, for example, by any of these column headings, such as year of graduation. So if I wanted to take a look at all of my seniors and their health office visits, I could choose, hold my control button down and click on the first student in that year of graduation. Scroll down and find the very last student in that year of graduation and hold my control button down again and click next to the name of the first student I do not want to include. So I can see I have 135 students that are selected here, which are my seniors in this instance. And I want to see the log of health office visits for that particular group of students. And what I can do is I can indicate the date range. So if I want to see it for the entire school year, I can indicate that date range. I can start a new page for each student. I can print both the open and closed items. I can select information that I want to print on that particular report as well. So, and I do have mine set up to preview. So I'm going to go ahead and click on print, and I'll let it put those reports together here. And what I see is it's going to show me student by student here. I guess in this instance, I must only have one student that has a visit because it's not giving me additional pages here, which it would if there were additional pages. But in this instance, it's showing me Christine and the reason for visit and the location, the dates, the times in and out, planned visits, anything that was recorded in error, and so forth. So it's a nice summary of the health office visits, and it shows me the date that I'm actually printing that particular report. And so I'm going to go ahead and close out of that for a moment. And also something important to note about the reports, if in fact you set this report up like we did, you choose the options that you want to see, you preview it, and it looks like it is the information that you need, then a very useful feature is to go ahead and save settings so that you can come back at any later time and recall those settings. So if I add new record and I have the log of health office visits, I'm just abbreviating here, for seniors, and then I choose, I can lock it if I don't want anybody else coming back in and making changes to it. I can choose to select the item then, and it will save those settings. Therefore, if I exit out and come back, at any later time, I can choose to recall settings. I choose the setting I set up previously, and it will pull in those settings. So that's a very useful feature. Let's see, other health editing jobs. Looking for items that we haven't talked about yet. Editing screenings, and that's another option that you have as far as the screenings go, as far as getting to that particular information, as opposed, so you go through the menu option here in Health Management Jobs or use the toolbar. So again, flexibility in the way that you access the information that's available. Same with student health history, more information on entering immunizations, Preventative education, the different codes as we looked at, editing immunization requirements. So again, that can be done directly in the immunizations as we looked at on the toolbar, or can be done using the health management jobs menu. And then additional reports. So we looked at many different examples of these as we were looking at specific student information. But again, if there are particular reports we want to look at on a group basis, so for example, one of the perhaps popular reports are the tally reports. If we want to see tallies according to health office visits by medications, student health history, screenings, or preventative education, then we can simply go to that health tally reports option, and we can set up the particular tally report that we want to look at. And we do go into even more detail on some of these with some of the other webinars that we do. So if I click on one that I already have set up here, I'll click on the tally by hearing screenings. For example, I can see the criteria that have been selected here. If I scroll down, I can see additional criteria that were selected, and we can choose to go through the different tabs and include the particular items that we want to see on the tallies. So if I'm looking at the health office visits, then the criteria that I see for that particular report and that tally report is going to be based on the tab I'm looking at. So we can choose the description of the report here. We can choose the particular codes that we want tallied up. We can choose to tally by time period. We can print totals by month or by gender. We can see who is logged in as far as creating that particular tally report. We can indicate grade levels. We can tally by location. So a lot of good information available here. Tally by assessment. We can indicate which of the assessment codes that we want to include on that particular tally. And again, the grade levels, we can leave the grade totals off of the report. So a lot of different options as far as grouping and choosing and sorting out the information that you want to see for your tally reports. We have interventions, we have discharge. So really, the information that we've captured in the health module, we can then produce as a tally report depending on the information we choose. We have a tally according to medications. You can choose totals by month or gender. You can limit according to whether it's a provider order or a school order, types of medications, totals of medications. And so if I'm looking at, for example, one of these particular tabs here, and I make my choices about what I want to include on the particular report, on that tally report, I can choose to add. So then what will happen is when I choose to add, okay, so if there's any information I haven't selected, it will alert me to that. Select a grade level. So there are some requirements here, and I'll just look at my example of seniors in this instance. Okay, so I have to include at least one type of medication. I can include a group by holding the Shift button and clicking a particular group of medications if I want. Okay, so when I add that, it automatically is added to this Print Tallies tab. So I'll click on that medication, type of medication tally. Again, it shows me the specific criteria that I selected, shows me a date range that I can indicate. I can indicate the student range, although I did choose a particular grade level in this instance, so I probably wouldn't need to do that. And let me just click on print here. Are you sure you want to print the selected tally line? You get that confirmation. And I may or may not have picked one that has matches based on the medications that I chose. Let me see if I can get one for health history, for example. So we can at least get an example of a tally here. So it didn't find any matches for those medications, which is why it didn't show me that information. So in this instance, for the health tally report, we can see that we're sorting it by gender, can see the date range. We're looking at the health history tally, and we see the different codes listed here and the totals for males and females. So it takes a little bit of time, experimentation, and so forth in deciding what information is most valuable for you. But that is valuable and useful information in these health tally reports. So this is a good introduction to those. So I'll go ahead and exit out of there at this point. And let me see if there are any other items that we didn't touch on here. Also, immunization certificates, if that's something that you need. Okay, I don't have settings stored for that, but you have the ability to print up to 18, as you can see, for a particular student or group of students that you can also indicate in the student range, indicating exemptions if needed, contact information if needed, blank certificates if needed, the title for the certificate. So a lot of very useful information here. You set up the first 18 immunizations that you want to have included, and then you can also set up to 10 more as well. And so I think it said I didn't have any stored settings for that. Okay, so if I try to print this, let me see, it's going to go through all the students, but I think I have some information in for at least one student. So we should be able to see an example here. Okay, so we're looking at, okay, so Robert in this instance. So this is actually printing the blank ones because I selected that as an option. So you have the ability, and if I page to the next student here for Amy, I can see the actual information that is entered for her immunizations, because when we looked at immunizations, she did have information in that particular portion of the health module. So it's nice to see how this looks then once you put the information in about your students. You have a lot of great opportunities for the output, the reports, the data that you need. So, and if I wanted to print that, of course, I could choose to print my report. But again, this is intended certainly as a nice introduction here. I don't think we looked at the screening report. Let me go back to that. So this would be in the instance of course, looking at a group of students or your entire student population, a grade level, whatever the case may be. We have the student range option available. And as you see here, you get a little reminder at the top. You can use this to print the results of specific exams. So you can indicate specific ones. If you wanted to print all the dental exams, all the screenings, you could deselect the other options, or you can simply print all. And what I'll do in this instance, so you can see an example, is I'll just choose a student that I know has some of this information entered. And then you can indicate skipping empty exams for that student, pass the exam, fail, missing, fit for physical activity. Also, other report options, if there are physical restriction notes, screening notes, starting a new page for each student. If you're looking at this for a group of students, you may want to see a separate page for each student. Again, including contact information. And then if you say yes, you designate which one. And then also limiting dates as well, and limiting based on examiner. I'm not going to limit that in this instance here. What I'll do is I'll just click on print so we can see an example for Amy. So you can see the information that's included based on what someone with access to the health module has entered for Amy's screenings. So it's showing us her contact information, her name, her ID number, and the screenings that we have on file for her. So I'll go ahead and exit out of that at this point here. Let me see if there's anything else that we haven't touched on as far as an introduction here today. If also you want to print a list of your health condition codes, for example, the ones that you have, the defaults that you loaded or any edits that you made, whether it's a particular code listing for health conditions, health office visits, medications, you have that option under health reports. Or you can save a soft copy so you have it available in that format. You can choose the category of codes that you want to print, and you can select and deselect as needed. So maybe I just want to see my health conditions, communicable diseases. I'll just pick those two, for example, and my output option is set to preview. I will leave it set up that way. If I wanted to save a soft copy, I could indicate that as like a PDF, for example. So it's going to show me exactly what I have in fact entered here and listed within the health module as far as showing me my communicable diseases. Here in the first page, then the health conditions and the different criteria that I've selected, no or yes, for the different, for confidentiality, being a health alert or a lunch alert, a school lunch alert, and I can just continue to page through the information here. So this is including everything that we would have entered in the edit options for the health conditions, for communicable diseases, and so forth. So you have the ability to print or review or save soft copy of all that information. See if there's anything else. I think that includes a pretty good overview of the different aspects of the health module. We looked at the health office visits today, the basics of the information that we can log there in that section, accessing these health options through either the toolbar or the health management jobs. The shortcuts here for logging health office visits, medications, immunizations, health history, and screenings, some of the different report options. And again, if you have additional questions, you are always welcome to sign up for another live webinar that we offer, and you'll see those available on our website, as well as many of the different pre-recorded sessions in our video learning center, and also the knowledge base articles as a very, very helpful and valuable resource for you. I thank you very much for your time today, and we hope to see you at another session coming up. Have a wonderful day. Thank you.